Question 1. A resident has right-sided hemiplegia following a CVA but can move the left side normally. The care plan calls for the resident to lift and move the right arm using the left hand. This type of exercise is called, is it A, passive range of motion, PROM? B, active assistive range of motion, ARM? C, resistive range of motion? D, isometric resistance? The correct answer is B, active assistive ROM, ARM, occurs when the resident moves a weaker limb with help from the stronger limb, self-assist, or from the CNA. Passive ROM, A, means the CNA moves the joint while the resident does no work, used when the resident cannot move at all. Active ROM means the resident moves independently with no assistance. Resistive, B, adds external force against motion, rehab/PT. Isometric, D, is muscle tightening without joint movement. Per 42 CFR Section 483.25, C, facilities must prevent decline in ROM unless clinically unavoidable. Question 2. A CNA is providing restorative nursing care to a resident recovering from a hip fracture. Under 42 CFR Section 483.24, what is the primary goal of restorative care? Is it A, to complete tasks for the resident as quickly as possible to save time? B, to prevent the resident from leaving the long-term care facility? C, to return the resident to a hospital setting for further treatment? D, to help the resident attain or maintain the highest practicable level of independence? The correct answer is D, 42 CFR Section 483.24, Quality of Life, and Section 483.25, Quality of Care, require facilities to assist each resident to attain or maintain his or her highest practicable physical, mental, and psychosocial well-being. Restorative nursing focuses on preserving and regaining function, preventing decline, and promoting independence in ADLs. Doing tasks for the resident, C, fosters dependency and violates restorative principles. Hospital return, A, and preventing departure, D, are unrelated to restorative goals. Title 22 CCR Section 72315 obligates nursing services to support each resident's functional abilities. Question 3. A CNA is preparing to perform a sit-to-stand transfer with a resident who has mild left leg weakness. Which action best promotes safety and resident independence? Is it A, perform the transfer without a gait belt to speed up the process? B, apply a gait belt, position the resident's feet flat, and have the resident push up from the bed with both hands on count of 3? C, lift the resident under the arms while telling them to relax their legs? D, have the resident grab the CNA's neck for support during the rise? The correct answer is B, per Title 22 CCR Section 72315. Transfers must protect both resident and staff. The correct technique, apply a gait belt at the waist, position feet flat and shoulder width apart, have resident lean forward, nose over toes, and rise on a counted cue using their own leg strength. Lifting under the arms, B, can cause shoulder dislocation and removes the active component. Grabbing the CNA's neck, C, risks cervical injury to staff. Skipping the gait belt, D, violates safe handling policies under 42 CFR Section 483.25, D, accident prevention. Question 4. Which activity is most appropriate to offer a resident with moderate dementia who enjoyed gardening throughout her life? Is it A, completing a 1,000-piece jigsaw puzzle independently? B, a sensory activity such as planting seeds in a small pot with the CNA's hands-on assistance? C, watching a fast-paced action movie alone in her room? D, a complex 3-hour lecture on horticulture? The correct answer is B, therapeutic activities for residents with dementia should match retained abilities, draw on lifelong interests, and offer sensory engagement and success. Hands-on planting honors her identity and provides tactile, olfactory, and visual stimulation. A long lecture, B, exceeds attention span and causes frustration. Isolated movie watching, C, increases agitation and provides no engagement. A 1,000-piece puzzle, D, is far beyond cognitive capacity and causes failure. 42 CFR Section 483.24 requires activities that maintain psychosocial well-being. 42 CFR Section 483.10 protects the right to make choices about activities. Question 5. A resident with rheumatoid arthritis has difficulty gripping a standard fork. Which adaptive intervention best promotes independent eating? Is it A, switch the resident to a pureed diet without consulting the dietitian? B, feed the resident the entire meal to avoid frustration? C, provide built-up handle utensils, a plate guard, and a non-slip mat? D, withhold all food until the resident can use a regular fork? The correct answer is C, adaptive utensils, built-up handles, rocker knives, plate guards, and non-slip mats allow residents with limited grip or coordination to feed themselves, preserving independence and dignity. Feeding entirely, A, creates dependency. Diet changes, B, are physician/dietitian decisions. CNAs cannot alter diet orders. Withholding food, D, is neglect under 42 CFR Section 483.12, abuse/neglect prohibition. 42 CFR Section 483.25 requires support of nutritional status and functional ability. Title 22 CCR Section 72315 requires the nursing service to meet daily living needs. Question 6. A resident asks the CNA to read aloud from the Bible at bedtime. The CNA practices a different faith. The most appropriate response is to: is it A, refuse and tell the resident to find someone of the same religion? B, tell the resident religion is not part of the CNA's job? C, respectfully read the requested passages or arrange another staff member or chaplain to do so, honoring the resident's spiritual care? D, try to convert the resident to the CNA's faith? The correct answer is C, 42 CFR Section 483.10 F 11. Protects each resident's right to religious and spiritual practice. The CNA may read the passage or, if uncomfortable, arrange another staff member, volunteer, or chaplain. Refusing without alternatives, A, D, is denial of spiritual care. Proselytizing, B, violates the resident's rights and may be psychosocial abuse. Spiritual care reduces anxiety and improves coping in LTC. The CNA respects each resident's faith, dietary practices, and rituals without judgment, consistent with 42 CFR Section 483.40, Behavioral and Psychosocial Care. Question 7. A CNA, frustrated with a wandering resident, locks the resident in a room without a physician order or care plan justification. This action is it A, false imprisonment, prohibited use of restraint under 42 CFR Section 483.10 E, and Section 483.12 A2, abuse under WNI Section 15610.07, and grounds for criminal charges, civil liability, and certification revocation? B, acceptable if family approves. C, acceptable if it is only for a short period. D, legal because the door has a window? The correct answer is A, confining a resident against their will without medical justification, physician order, and informed consent is false imprisonment, civil and criminal tort, and unlawful restraint under federal nursing home regulations. Duration, A, door windows, B, or family approval, C, do not legalize unlawful confinement. The resident has the right to be free from restraints not required for medical symptoms. CDPH may issue immediate jeopardy citations. The CNA faces termination, certification revocation under HSC Section 1337.9, and possible criminal prosecution. Always use approved behavior plans and least restrictive interventions. Question 8. Under HIPAA's minimum necessary standard, 45 CFR Section 164.502, B, a CNA should access protected health information, PHI is it A, whenever a family member or friend requests it. B, for coworkers as a courtesy. C, for any resident in the facility out of curiosity. D. Only to the extent needed to perform their assigned job duties for assigned residents. The correct answer is D. HIPAA's minimum necessary standard, 45 CFR Section 164.502(b), requires covered entities to limit uses, disclosures, and requests for PHI to the minimum necessary to accomplish the intended purpose. A CNA accesses only the records of assigned residents and only the information needed to provide care. Browsing charts for non-assigned residents, B, looking up coworkers, C, or sharing with unauthorized friends/family, D, is a HIPAA violation, grounds for termination, and may carry civil penalties up to $50,000 per violation, max $1.5 million/year, and criminal penalties up to $250,000 and 10 years for malicious disclosure under 42 U.S.C. Section 1320d6. Question 9. A resident recovering from a left CVA has right-sided hemiplegia and mild dysphagia. Which CNA action is most appropriate at mealtime? Is it A. Mix all foods together to make swallowing easier? B. Position upright at 90 degrees, place food on the unaffected left side, allow time, and observe for choking. C. Feed the resident quickly while lying flat to save time. D. Place food on the affected right side of the mouth? The correct answer is B. Dysphagia care requires upright positioning, 90 degrees, small bites, food placed on the unaffected side, the resident has sensation and motor control there, chin tuck if ordered, and observation for coughing, pocketing, or wet voice. Feeding lying flat, A, causes aspiration. Mixing foods, B, is unappetizing and does not improve swallow safety. Placing food on the affected side, C, causes pocketing and aspiration. 42 CFR Section 483.25 and Title 22 CCR Section 72315 require staff to follow the care plan and prevent avoidable harm such as aspiration pneumonia. Question 10. A 78-year-old resident has begun drinking large amounts of mouthwash. Empty bottles are found in his bedside drawer. The CNA should, is it A, report to the charge nurse immediately, document the observation, and ensure mouthwash with alcohol is removed and replaced with an alcohol-free product as ordered. B, confront the resident and demand he stop. C, ignore the behavior since alcohol use is the resident's right. D, hide the mouthwash without telling anyone? The correct answer is A. Substance use disorder in older adults is under-recognized and dangerous, falls, GI bleed, drug interactions. Ingesting alcohol-containing mouthwash is a red flag. The CNA must report observations to the nurse so the physician can assess and the IDT can revise the plan, alcohol-free mouthwash, screening, possibly addiction medicine consult. Ignoring, A, abandons clinical duty. Confronting, C, is shaming and outside CNA scope. Hiding without reporting, D, defeats care planning and may itself be a form of self-neglect facilitation. Under WNI Section 15610.07, self-neglect is a form of reportable elder abuse. Question 11. California's HSC Section 1276.5, the 3.5/2.4 rule, requires skilled nursing facilities to provide a minimum of how many direct care nursing hours per resident day? Is it A, an average of 3.5 nursing hours per resident day, NHPRD, with at least 2.4 hours provided by CNAs? B, no statewide minimum exists. C, 1.0 NHPRD with no CNA minimum. D, 5.0 NHPRD all from RNs only? The correct answer is A, HSC Section 1276.65, the staffing rule that succeeded Section 1276.5's earlier 3.2 standard, effective 2018, requires SNFs to provide a minimum of 3.5 direct care nursing hours per resident day, NHPRD, with at least 2.4 hours of those provided by CNAs and the remainder by licensed nurses, RN/LVN. Title 22 CCR Section 71203 contains related staffing standards. The 160-hour CNA training requirement is HSC Section 1337 SE 2/Title 22 CCR Section 71835, CDPH approved, exceeds the 75-hour federal minimum under 42 CFR Section 483.152. Facilities cite for failing to meet staffing minimums. Question 12. A CNA, who is also a parent volunteer at an after-school program, observes a child with multiple unexplained burns. Under California law, the CNA is it allowed to wait until the family explains the injuries? B. A mandated reporter of child abuse under Penal Code Section 11166 in their professional capacity as a CNA, and must report to a child protective agency immediately. C. Only required to tell the school principal. D. Not required to report because it occurred outside the LTC facility? The correct answer is B. Under PC Section 11165.7, health practitioners, including CNAs, are mandated reporters of suspected child abuse or neglect, in addition to their elder abuse duties under WNI Section 15630. PC Section 11166 requires an immediate telephone report to a child protective agency, police, sheriff, or CPS, as soon as practicably possible, followed by a written report within 36 hours. Waiting for family, C, or only telling the principal, D, does not satisfy the statute. The duty applies whenever the mandated reporter, in their professional capacity or within the scope of employment, learns of or observes suspected abuse. How many of these 12 did you get right so far? Subscribe to PrepPass so you can come back and drill the rest before your exam. Question 13. A CNA with a documented back injury asks the employer for a reasonable accommodation, use of a mechanical lift for all transfers. The employer must, reduce the CNA's pay automatically. B. Tell the CNA to work through the pain. C. Engage in a good faith interactive process to identify reasonable accommodations that do not cause undue hardship, under ADA Title I, 42 U.S.C. Section 12112, and CA-FIHA, Gov Code Section 12940, M-N. D. Refuse and terminate the CNA? The correct answer is C. ADA Title I, 42 U.S.C. Section 12112, and California's FIHA, Gov Code Section 12940, M-N, require employers to engage in a timely, good faith interactive process with employees who have known disabilities to identify reasonable accommodations, modified equipment, schedule changes, job restructuring, that allow the employee to perform essential job functions without undue hardship. Refusal, A. Pay cut, B. Or requiring the CNA to work through pain, C. Violate disability rights laws and may also violate Cal/OSHA safe patient handling requirements, Labor Code Section 6403.5. The CNA may file with DFEH/CRD or EEOC. Question 14. A resident's adult daughter visits and becomes loudly critical of the CNA's care in front of the resident. The CNA's best response is to, argue with the daughter to defend the care given. B. Remain calm, listen without interrupting, acknowledge concerns, offer to discuss privately, and notify the charge nurse. C. Tell the daughter to leave the facility immediately. D. Stop providing care to the resident as long as the daughter visits? The correct answer is B. Difficult family dynamics are common and rarely about the CNA personally. The CNA should remain professional, use active listening, acknowledge feelings, and invite a private conversation that includes the nurse or social worker. Arguing, A. Escalates and risks complaints. Ordering family out, B. Exceeds CNA authority and may violate visitation rights under 42 CFR Section 483.10 F4. Withdrawing care, D. Is abandonment. The charge nurse documents the interaction and coordinates with social services per Title 22 CCR Section 72527, Resident Rights. Question 15. Under California Welfare and Institutions Code Section 15610.07, which of the following is not a recognized form of elder abuse? Is it a financial abuse such as taking the resident's pension check? B. A resident voluntarily refusing a piece of dessert? C. Physical abuse including unreasonable restraint? D. Neglect and self-neglect? The correct answer is B. WNI Section 15610.07 defines elder/dependent adult abuse to include physical abuse, Section 15610.63, sexual abuse, neglect, Section 15610.57, financial abuse, Section 15610.30, abandonment, abduction, isolation, and the deprivation of goods or services necessary to avoid physical harm or mental suffering. Self-neglect is included. A resident's voluntary refusal of an offered dessert, D, is the exercise of the right to refuse, not abuse. CNAs are mandated reporters under WNI Section 15630 and must report suspected abuse, including by other staff, family, or visitors. Question 16. A resident with dementia repeatedly wanders out of her room and into other residents' rooms. The most appropriate first response is to, is it A, place her in a wheelchair with the tray locked in front to prevent her standing up? B, lock her room door from the outside? C, gently redirect her, walk with her, and engage her in a familiar activity, then notify the nurse to update the care plan? D, apply a vest restraint to keep her in bed? The correct answer is C, wandering is common in dementia and is best managed with redirection, supervised walking, scheduled activity, environmental cues, clear signage, safe walking paths, and care plan review. Restraints, A, D, without medical necessity and informed consent constitute false imprisonment and abuse under 42 CFR Section 483.12 and 42 CFR Section 483.10 E, right to be free from restraints. Locking residents in a C is also unlawful restraint. The CNA reports patterns so the IDT can identify triggers, boredom, pain, toileting needs, and adjust the plan. Question 17. A CNA reports unsafe staffing ratios and unsanitary conditions to CDPH. The facility administrator threatens to fire the CNA. This retaliation is it A, legal because the CNA is an at-will employee? B, illegal, California Whistleblower Protections, Labor Code Section 1102.5 and HSC Section 1432, prohibit retaliation against employees for reporting violations of law to government agencies or refusing to participate in unlawful activity. C, only illegal if the CNA's complaint is sustained. D, legal as long as the firing is not in writing? The correct answer is B. Labor Code Section 1102.5 prohibits employer retaliation against employees who disclose information to government or law enforcement agencies, or to a person with authority to investigate, where the employee reasonably believes the information discloses a violation of law. HSC Section 1432 specifically protects LTC workers who report quality of care concerns. Remedies include reinstatement, back pay, civil penalties, up to $10,000 per violation, and attorney's fees. Whether the complaint is ultimately sustained does not change protection. The test is the reporter's reasonable belief and good faith. Question 18. A CNA posts a TikTok video taken in the nursing facility hallway. Two residents appear in the background, identifiable by face. This is it A, allowed if the CNA's manager likes the post? B, a HIPAA violation that may result in termination, civil penalties up to $50,000 per violation, and possibly criminal charges? The CNA should remove the post immediately and self-report. C, allowed if the CNA blurs the faces after posting. D, allowed because the residents are not the main subject? The correct answer is B. Any image or video that allows identification of a patient in a healthcare setting is PHI under HIPAA, 45 CFR Section 160.103. Posting without explicit written authorization violates 45 CFR Section 164.502. Civil penalties, 42 U.S.C. Section 1320d5, tier from $100 to over $50,000 per violation up to $1.9 m per year per identical violation. Criminal penalties, 42 U.S.C. Section 1320d6, can reach $250,000 and 10 years imprisonment for wrongful disclosure with malicious intent. The CNA must delete, self-report, and cooperate with the privacy officer. Background appearance, post hoc blurring, or manager approval do not cure the violation. Question 19. A devout Catholic resident is actively dying. The family asks that a priest perform the anointing of the sick, last rites. The CNA should, notify the nurse so a Catholic priest can be called promptly, ensure privacy, prepare a small table with a white cloth, and respect the ritual. B. Perform the rite themselves to save time. C. Wait until after the resident dies to call the priest. D. Tell the family the facility does not allow religious rituals. The correct answer is A. 42 CFR Section 483.10 F. 11, protects the right to religious practice. The anointing of the sick, formerly extreme unction, is a sacrament administered by a Catholic priest, ideally while the resident is still conscious. The CNA's role: notify the nurse, contact the chaplain or family's priest urgently, ensure privacy and a calm environment, and prepare a small table with a white cloth, candle, and crucifix per Catholic tradition. The CNA does not perform the rite, D. Denying the rite, A, or delaying, B, violates rights and causes spiritual distress. Question 20. A resident asks a CNA, "Will you hold my hand for a few minutes? I'm scared." Therapeutic touch in this context is it only permitted if family is present? B. Always inappropriate and a boundary violation. C. Appropriate, comforting, and within scope as long as the touch is welcomed, professional, and non-sexual. D. Only acceptable if a physician orders it. The correct answer is C. Holding a hand at the resident's invitation is a humane, therapeutic gesture and within CNA scope when professional, non-sexual, and consensual. The CNA should always confirm consent. Would you like me to hold your hand? Respect cultural norms about touch. Some cultures restrict opposite-sex touch outside care tasks, and document significant interactions. Touch that is sexualized, prolonged inappropriately, or unwanted is misconduct and may constitute abuse. Family presence, C, and physician orders, D, are not required for ordinary comforting touch under 42 CFR Section 483.10, dignity. That's the set. If these helped, subscribe to PrepPass, then run the full practice test for free at preppass.org before your exam day.